Welcome back to Deep Dive, where we explore the big stories and trends shaping our world. Today's episode tackles a critical topic, one that affects every one of us, whether we realize it or not. We're talking about healthcare. Specifically, we're looking at how China is not only keeping pace but, in some cases, pulling ahead of the United States in healthcare innovation. From AI diagnostics to fully automated hospitals, China's healthcare system is transforming at a rapid pace. Meanwhile, the US is dealing with an outdated, expensive, and fragmented system that struggles to adapt. So what's the reality here? What potential do these systems hold, and what are the consequences if one country charges ahead while the other lags behind? Let's start by laying out the fundamentals. In the US, healthcare is primarily market-driven, meaning it's built around private insurance and hospital systems. For some, this system offers access to top-notch medical services, but it also comes with enormous costs and complexities. For example, earlier this year, a young child in San Diego was rushed to the hospital after a rattlesnake bite. After 2 days in intensive care and some antivenom, his family was hit with a $297,000 bill. A cost breakdown that highlights just how pricey US healthcare can be. Now, let's look at China. The Chinese government plays a central role in providing basic health insurance to most people and keeping costs low, especially in urban areas. Although it's not fully universal, there's a focus on affordability and predictability. In major cities like Shanghai, patients can visit hospitals with government-subsidized healthcare that gives them immediate access to a doctor, often for only a few dollars out of pocket. Now, let's take a look at the current realities of each system. In the US, administrative costs and complex insurance requirements mean that even basic care can be expensive. According to a recent survey, a third of Americans reported delaying medical care due to high costs. Meanwhile, China has challenges, too, particularly in rural areas. A few years ago, a report highlighted that rural residents often face limited access to quality care. But in cities like Beijing, people have access to top-tier technology, including AI diagnostics and robotic surgeries. A recent example? In 2022, a hospital in Shanghai used a 5G-enabled robotic system to perform a remote operation on a patient located hundreds of miles away. This tech-driven adaptability allows China to solve many bottlenecks that still weigh down the US system. So, where does automation fit in? Here's a real-world example from Guangdong, China, where the first AI-assisted hospital, Guangzhou Women and Children's Medical Center, has made headlines. This hospital uses AI to diagnose lung disease from X-rays, cutting down on diagnosis time and improving accuracy. In some cases, diagnoses that took hours are now completed in minutes. Meanwhile, what about the US? Despite having tech giants and leading medical institutions, healthcare automation is often limited to isolated projects. Take the Cleveland Clinic, for example. It's adopted AI for specific radiology departments, but such tech is still rare across US hospitals. Unlike China's national push for automation, the US lacks a cohesive strategy, and patients often don't benefit from this technology unless they're in major hospitals or research institutions. Now, let's imagine what each system could look like at its best. In the US, there's enormous potential to combine its innovation power with a more affordable, accessible model. Imagine a system where hospital costs are slashed by automation, where AI-driven diagnostics cut wait times, and where medications don't cost a fortune. But without a unified national strategy, much of this remains hypothetical. In China, we're already seeing this vision unfold. In fact, during the COVID-19 pandemic, Chinese hospitals in Wuhan used robots to deliver meals and medications, minimizing infection risk. AI-driven triage helped doctors make rapid diagnoses during overwhelming case surges. By making automation a priority, China is setting up a healthcare system that could meet its population's needs quickly and affordably. So, what happens if the US continues on its current path? First, there's the economic impact. Let's take insulin as an example. In the US, diabetic patients often pay hundreds for insulin that costs a fraction to produce. Rising healthcare costs mean families spend more on basic care, reducing their disposable income and harming the overall economy. Meanwhile, high costs discourage people from seeking early treatment, which can lead to worsened conditions and even more expensive care later on. Now, think globally. If China's affordable, tech-driven healthcare model proves successful, it could become a template for other countries, especially developing nations. This shift could weaken US influence in healthcare standards and technology. Imagine a future where countries look to China, not the US, for advanced medical equipment, AI tools, or automated hospital systems. This dependency could lead to a strategic disadvantage. Finally, there's the issue of national resilience. During COVID-19, gaps in the US healthcare system became stark. Testing was delayed, hospitals were overwhelmed, and logistical issues hampered vaccine distribution. Compare that to China, which deployed thousands of testing sites in days and used AI to manage contact tracing and diagnostics. So, what can the US do to avoid falling behind? For starters, it needs a national strategy focused on healthcare automation and tech integration. Embracing innovation and shifting the focus toward accessibility, rather than just profit, would be essential. Just as the US invests billions in defense and space exploration, similar investment in healthcare technology could spark the transformative change needed to keep pace. Ultimately, the choice is clear. The US can modernize its healthcare system and compete in this tech-driven age, or it can continue with a fragmented approach and watch as others pull ahead. And as we've seen with China's advancements, that gap is already widening. Thanks for joining me on today's deep dive. If there's one takeaway, it's that healthcare isn't just about treating patients. It's about designing a system that works for everyone, efficiently, affordably, and reliably. China's advancements show us that the future of healthcare is here. The real question is, are we ready to meet it? Don't forget to subscribe to our channel and like this video, this helps us a ton. Stay tuned for more insights on the stories shaping our world by following this podcast series. Until next time, stay curious and keep questioning. This has been a pleasure. My name is Ben, and I'm signing off.